Welcome back to Hometown Health, serving Lake County and the Villages. I'm Mark Roberts.
And I'm Beverly Onstead, on set in Studio H at Lake Sumter Community College.
Before the break, we were talking about the role that smoking plays on the body. And while the use of tobacco is generally on the decline in the United States, obesity is expected to reach pandemic proportions by the year 2030. According to F as in Fat, How Obesity Threatens America's Future 2012, a report released by the Trust for America's Health and the Robert Wood Johnson Foundation, if obesity rates continue on their current trajectories, by 2030 all 50 states could have obesity rates above 44%. In Florida, rates could reach over 58%. According to the latest data from the U.S. Centers for Disease Control and Prevention, in 2011, 26.6% of adults in the state were obese. What does that mean to our health? Over the next 20 years, obesity could contribute to over 2.4 million new cases of type 2 diabetes, 6 million new cases of coronary heart disease and stroke, 3.2 million new cases of arthritis, and almost 900,000 new cases of obesity-related cancer in Florida. Dr. Samir Guru, specialist at Florida Hospital Waterman's Joint Replacement Center, explains the roles that obesity, smoking, and other lifestyle choices can have on your joints.
Smoking does have an effect on the joints as well as the bones. It does cause osteoporosis or thinning of the bones. Also, it does impede bone healing. If you were to have a fracture and you were a smoker, it decreases your healing by twice as much. Obesity does put a lot of stress on your joints, whether it's the hips or the knees, and we're seeing a lot of patients that are overweight needing joints at an earlier age. Also, of course, if they have an injury at a younger age, that predisposes them to developing arthritis in that joint at an earlier age. It's really hard to pinpoint. You know, everybody has a different reason. Some people get avascular necrosis. A lot of them are overweight. A lot of them, you know. I think the majority of younger patients that are getting joint replacements are because of obesity. And then there are some that, of course, have injuries. A lot of my patients come in and they can't exercise because they can't move. They're in so much pain. And, you know, a lot of physicians say, oh, I'm not going to do your joint replacement because you're too young. You know, but now with the improvement in technology, I feel fairly comfortable, you know, performing a joint replacement on them so they can resume their quality of life and start, you know, on that path to weight loss and improving their life. Trying to stay fit. Not being overweight. Exercise is good. Keep the muscles healthy around the joint to support the joint better. And as with anything else, a good, healthy diet will sort of help you in that respect. There are patients that have their joints replaced and they fall back into that vicious cycle. They don't want to go out and exercise. So it's mainly it's a motivation factor. I mean, it's an individual thing.
For more information on Florida Hospital Waterman's Joint Replacement Center, follow the Joints and Lifestyle story icon at yourhometownhealth.com.